Hi, friends. Today I'm going to give you 5 tips that stop a panic attack fast. If you're watching this, you are probably dealing with panic, or you're afraid one might hit at the worst possible moment. Or maybe you just have someone that you really care about in your life that deals with these. Here's the truth most people never hear. Panic attacks, while wildly uncomfortable, are not actually medically dangerous, but they are incredibly convincing. They trick our bodies into believing that something truly terrible is happening right now, when really it's just a false alarm. So, today, as I said, I'm going to give you 5 of the lesser known tips that help your body ease out of that panic attack really quickly and also reduce how often they'll happen in the future. These are not the usual just breathe or think positive suggestions. These are going to be strategies that are grounded in how our nervous system actually works. And once you learn them, you get your power back. So let's get into it. Hi, I'm Amy Rose White. I'm an integrative psychotherapist making videos on self-healing tools. Tip 1, use the outrageously slow exhale. Most people do not hear this advice. Most people hear the advice, just take a deep breath. But when you're panicking, that can actually make things worse. Deep breaths can trigger hyperventilation. So instead, I want you to try something different. Make your exhale way longer than your inhale, ridiculously longer. So here's how. We inhale just naturally, maybe for 2 or 3 seconds. You don't have to count. And then we exhale for 6 to 8, or we just stretch it out as long as we can. And you repeat that for a minute or 2. You don't need big dramatic breaths. You need these long, slow, lazy air just leaving your body. So why this works? That long, slow exhale signals what we call the ventral vagus nerve, which runs from the brainstem all the way down through the stomach into the guts, which is kind of our body's calm down switch. Those long exhales tell the brain literally we're safe and can stand down. We simply cannot be exhaling slowly and activating that nerve and be about to die at the same time. So you can use these somatic tools to override that waterfall of sequences that happen when the brain perceives danger, which is basically what's happening with panic. Our brain is taking in some physical internal signals, maybe something that we feel in our stomach or our breathing, or an external signal, something we notice in the environment or thought we had, and it's perceiving imminent threat to our lives in that moment. So when we use these somatic techniques, we're overriding that error message and getting back into the truth of safety in the moment. So go ahead and let your shoulders drop, let your jaw unclench. Let the air fall out of your lungs like a quiet sigh and stretch long like taffy. Within 30 to 60 seconds, your heart rate and your adrenaline will start recalibrating. Tip 2, change your temperature fast. This is one of the fastest physical interrupters of panic, and most people have never been told about this. What we do here is we use a cold burst to interrupt that panic circuit. Your body just cannot maintain full panic and be in that fight, flight, or freeze state with sudden thermal change at the same time. So that sudden change redirects blood flow and it shifts your focus. So here's a few options. A cold pack, like an ice pack from your freezer that you put in your kid's lunch, splashing cold water, holding something frozen like a pack of peas, stepping outside into the cold air, even running your wrists under cold water works. So as we do this, we feel the cold. We keep breathing and we let our body react. We're not trying to think calm. We're just trying to interrupt that panic program. And this technique is used by therapists trained in dialectical behavior therapy and trauma-informed stabilization because they are very here and now, present moment, safety focused. And that's what's going to help your brain shift from that panic mode into I'm here, I'm safe, and I can reconnect to my center. Tip 3 is to reduce mental overload with the one object look. So during a panic attack or when we're starting to get there, our mind is scanning everything at once, or at least it's trying to. It's kind of like having 47 tabs open in your brain. The lesser known fix is to pick one object in our environment and describe it in extreme, unnecessary detail. So not in your head, but out loud if possible. So for example, you might glance at something in your kitchen like a mug and say, this mug is dark blue It has a chipped corner. There's a scratch on the handle, and the light hits one side more than the other. And you just kind of keep going like this. So, why this works? Your brain can't sustain a panic spiral and slow, detailed sensory processing at the same time. So, even better if you're feeling it while you're describing it, because it forces that neurological downshift. It's not exactly grounding, it's that cognitive load reallocation. You're teaching your brain we're focusing, we're here, we're safe, we can handle this one thing at a time. Tip number 4, the let it peak paradox. This one is really rarely taught for some reason, but it is incredibly powerful once you understand it. So during panic, most people fight the sensations. They brace and they resist and we tighten up. But resistance sends that danger signal even higher in our brains. So the paradox is if you stop fighting panic and you allow it to peak, the peak actually collapses faster. This is physiology. It's very similar to a wave at the ocean, if you've ever been to the beach. You cannot stop. Once a wave has picked up enough momentum, it's gradually gaining in intensity. Yeah, if you've ever tried to put your hands out in front of a wave, you know how effective that is. So sometimes once that physiological response has started, we just have to let that wave crest, because that's the good news about the nervous system and panic and anxiety is that no wave lasts at the peak forever. It eventually physiologically has to decline, decrease, and go back to baseline state eventually. Panic attacks do, just like the waves, they burn out. They can't sustain a high level for that long. So you don't have to like this. You don't have to enjoy it. You just have to give it permission to pass. So you might tell your body, okay, if you need to peak, go ahead. I'm not running. And you keep breathing, focusing on that exhale. When your brain realizes that the threat is really internal, it's not external, it can stop releasing so much adrenaline, and then that wave can crest and fall. And this is what we use in exposure therapy to dismantle panic at its core, is we just stay in it and we trust, because panic attacks have never killed anyone. And my last tip, tip number 5, is pre-interception, stopping panic before it starts. This tip can prevent a panic attack by catching it in the first 60 seconds before it spirals. So instead of reacting to full-blown panic, listen for those early whispers of symptoms. Slight chest tightness, feeling warm, a mild dizziness, racing thoughts. You know what your warning signs are. Maybe it's just that you have a something's off feeling. When you notice these early signals, do this immediately. Lower your shoulders, breathe out slowly, even if you feel fine, and then add a grounding sentence like, this is discomfort, not danger. My body is firing a little alarm, but nothing is wrong. I often tell my clients that panic attacks are kind of like when your smoke detector goes off, thinking that that there's a fire, but it's really just a bunch of steam from pasta on a pot on the stove. So if we can remind ourselves with that cognitive reframe and slowing the breath early on, that early response prevents that adrenaline and cortisol cycle from ever launching, which is part of panic. And it turns our nervous system kind of from what feels like an enemy into something that we understand. If you take one thing away today, let it be this. You are not powerless. Panic attacks are really intense, but they are predictable. And because they're predictable, they're manageable. If you'd like more on depression and anxiety management, check out this playlist right here, and I'll see you in the next one.